Hello, everyone. Good evening. This is evening in the UK. My name is Dr. Senthil Jayaseelan. I'm a consultant in anesthesia and pain medicine in the UK. This is the video series which we are doing called the Eye Opener series. So we talk about various specialties so that this gives some information to our young medical students so that they can make a choice when they are thinking about a career in a particular specialty. So this evening, I've got a great friend of mine, Dr. Karthikeyan, who is a consultant ENT surgeon in India. He has given his valuable time to speak to me to give information about this unique specialty. So without further delay, let me welcome Dr. Karthikeyan. Dr. Karthikeyan, hello there. How are you?
I'm fine. Hi, Dr. Senthil.
It's good to see you, Karthi. It's been a while, but it's lovely to connect up with you. Now, can I ask you a few questions which will be very useful for medical students so that they can make a choice when they are thinking about various specialties. Now, today you're going to talk about ENT. Now, what I want to ask you beforehand is that there'll be a few questions which I'm going to ask you. Some may be a little bit controversial as well, but I think it will help them make a decision when they are ready to take a particular specialty. So my first question is, as an ENT surgeon, what would you say as positives in your field, which a medical student, I mean, should consider before taking the specialty?
First, Dr. Senthil, I would like to thank you for giving me this opportunity to be a part of this promotional video for the medical students.
Thank you, Karthi. Thank you very much.
And for the medical students, everyone should understand that in our general outpatient practice, so major proportion of the cases are from ENT. As most of the public say, and even medical professionals say, it's ENT, it is not only ear, nose, throat. We can ideally call it as otorhinolaryngology. Similar to that of the number of alphabets in this specialty, we do have so many subspecialties or super specialties, or even we can call it as fellowships after we finish our initial post-graduation in otorhinolaryngology. So the super specialties, like say in otology itself, we do have external ear, middle ear, and inner ear. So in middle ear itself, middle ear implantation otology, inner ear neuro-otology, and implantation otology also includes cochlear implantation, brainstem implantation, cortical implantation, bone-anchored hearing aid. So many things are there in otology itself. Coming to rhinology, endoscopic sinus surgery involving only the nasal lesions, or endoscopic skull-base surgery, which again further is divided into anterior skull-base surgeons, middle skull-base surgeons, posterior skull-base surgeons. And coming to laryngology, is we do have the macroscopic laryngeal framework surgeons externally, or interior microlaryngeal surgeons only focusing on the vocal cords. So the super specialties or the fellowships are very vast after our initial post-graduation in this ENT. So, and on another thing, it is not only the vast thing, it also covers one of the, sorry, not one, 3 out of 5 special senses, that is hearing, smell, and taste.
Oh, Karthi, first of all, let me apologize for using the term ENT. I should have used otorhinolaryngology. Tonight, I'm going to practice this 1,000 times. I'm going to write in a piece of paper so that next time when I talk to you, I will use the term otorhinolaryngology. So going on to the next question, otorhinolaryngology, has it got any negatives that the field itself, so that the medical students can make a choice thinking about all those things as well?
The negatives, I can't say it is negative. The appropriate term to use is challenges.
Right.
So as of my experience, the first challenge is to select our teacher, or ideally saying mentor. I was very lucky to work under or get trained under one of the great doyens in the world, that is Professor Mohan Kameshwaran, and he is a multifaceted fellow. He is an otologist, cochlear implant surgeon, endoscopic sinus surgeon, head and neck surgeon for the oncology as well. So I had a chance to work under him, and I'm also a multifaceted thing or multifaceted fellow because of his training, and I'm practicing all this under this otorhinolaryngology specialty. So the first challenge is to find out our proper teacher or trainer. The second challenge, I would say, is the gadgets. Because this otorhinolaryngology is mostly using the endoscopic and microscopic anatomies, and not the macroscopic as other specialties use. So the major proportion of this endoscopic and microscopic involves the instrumentations. So we have to go for the purchase of the instruments as in any other specialties, but in this, we have to go for the upgraded versions each and every time. So we have to have a knowledge of the endoscopes, microscopes, or the HD cameras. Nowadays, it has come as 3 chips, 4 chips. So we should have an idea of the technological aspect as well, apart from the medical professional knowledge. So these are the only 2 challenges I would like to say that we have to face these 2 things.
Thanks, Karthi. Thanks for the very balanced view about the specialty. Now, the next question or final question would be, how should a medical student prepare himself or herself to become a very good ENT surgeon?
So to answer this, I'll say an example. So I can't explain the sweetness of a sweet, say Rasagula will be like this, delicious, tasteful, joyous. Unless we sweet or we taste that, we cannot sense that sweetness. Similar to that. So peep into these orifices during your otorhinolaryngology internship period. You will enjoy the nature's creation into these orifices, ear canal orifice, nasal orifice, oral, pharyngeal, and laryngeal orifices, and enjoy, and you will have the pleasure to see the natural behavior. And if you observe or if you have this pleasure, you will definitely find out the treasure to treat these pathological patients and keep them happy.
Thank you. Thank you very much, Karthi. Now, I just want to ask one final add-on question. If the medical students see this video in the near future through the forum, they may have a lot of questions about the specialty. Now, would you be happy to take those questions in the future, if you don't mind?
I'm most welcome to have these questions and answer the medical students to come into this specialty.
Thank you, Karthi.
There's 3 are coming into this. So definitely I would like to have more otorhinolaryngologists into this field. Once they sense.
I think you will make them write this term otorhinolaryngology a few times before. Maybe I should, again, as I said before. Right. Thank you very much, Karthi. Thank you very much for your time. And I hope to meet you soon. Thank you.
My pleasure to attend this meeting.